afternoon. You are tuned into Ability Matters, program that covers matters to do with abilities, disabilities and everything in between. Ability Matters is one of the longest running disability-related programs in the whole wide world. Starting as Headway On Air in 2007, you can now listen to podcasts of previous Ability Matters programs on YouTube and Spotify. Just search for Ability Matters. Ability Matters is brought to you by My Home Living Care, an NDIS registered disability.
Yes, that's right, Sean. I can actually say for real this time because you're actually sitting in the studio with me. How are you, Sean?
Good morning, Tony. Good, thanks. How are you?
I'm good, thanks. Yes, I should say I started at the beginning properly. Hi, I'm your host, Tony Scott Emilio, and on Illawarra's favourite community radio station, 106.9 VOX FM. And my usual host, Beck, is not here. I've got to thank, of course, Lil for her beautiful show, My Generation. I had a long time for saying the other show, yeah. Almost got confused there, no worries. Thank you again, Lil. Good stuff. Thank you.
Lots of great music, as always.
Beautiful tunes. I like it. Played a lot of ELO, which I'm a big fan of. Good stuff.
Ooh,
yes.
ELO.
Electric Light Orchestra. Good tunes, good tunes. My usual co-host, Beck, Beck from Flagstaff, is not with us today. She had
better offer?
I wouldn't say other pre-booked things.
Work commitments on.
Yeah, commitments, that's the word. I couldn't think of it. Yeah, good stuff. Anyway, so we're in the studio today with, what was your name again? Sorry, Lesley?
Lesley.
Hi, Lesley. And
Hi.
I'm trying to read your T-shirt and don't think I'm going to do that. It says Seachange Health Professionals.
Yeah, that's right. I'm one of the occupational therapists.
Beautiful. I've had a lot of experience with OTs, as you may not know, but yes, because I had a lot of brain injury, time with a brain injury, just get to the head and everything like that, but yeah. So yeah, I understand what OTs are all about, but you can explain it better than I can, so go for it. Fill us in. Yeah,
so I'll quickly jump in, and Leslie's probably we haven't talked about it, but one of the things with Beck and Tony is they've had Beck a stroke and Tony a head injury where they've had to learn to walk and talk and feed and relearn, do all that sort of stuff.
Basically baby again, so
yeah.
So talk about OTing or physio. They've lived from the other side and very real. And the good thing too with Tony I like is if we get a bit too technical, Tony will jump in and go, "What are you talking about? What's that acronym you just talked about? What does that mean?"
There's a lot of acronyms.
Yes.
Not so many that. I tend to not be afraid of having a more PG, or maybe less than PG explanation like it.
Yeah. Straightforward.
Yeah.
Exactly.
Yeah.
To the bone.
And it's good because working in this industry, there's a lot of acronyms and you do it to save time and save energy when you write things out, and so we get a bit lost in that sometimes. So it's good for Tony.
Even myself using the acronym earlier on, I said ELO.
Yeah, exactly.
That's the band Electric Light Orchestra.
Yeah.
So
makes it easier.
Yeah, so go for it. I'm Sean from My Home Living Care. We're the sponsors of the thing, and then I occasionally get lucky enough to step in when Beck's busy. So I'm in this week, as mentioned, with Lesley from Seachange Health Professionals.
That's
Leslie's an OT. And her organisation has a whole lot of stuff.
Another acronym, OT, Occupational
Therapist.
There you go. Yeah. OT's easier. It's okay.
Very short.
We'll talk about that in a sec, but first I'd be interested, Lesley. Good morning. Welcome to
Good
Ability
morning.
Matters.
Thank you for having me on. It's such an honour.
Awesome. A little talk about you first before we talk about what you do. So, where were you born and where'd you grow up? Well, tell us a little bit about young Lesley.
Yeah, sure.
Bit of an interrogation.
That's okay.
I'll just turn the spotlight off so that makes it a little bit less.
Yeah, I was born in South Africa in Cape Town, and my parents moved over during the apartheid. So obviously it was pretty hard times back then being a coloured South African.
Like early 80s or something?
Yeah, early 80s, yeah. So I was quite young. I was 2, so I call myself a South Aussie now because I'm a bit of half, a bit more Aussie.
Just quickly, can you remember anything from South Africa?
Oh, it's beautiful.
Yeah.
I remember being beautiful. A
Okay.
couple of times. Yeah. And I think that's why I'm drawn to Wollongong because it's the same as the mountains and the oceans meet. It's,
Cape Town got the mountains very close.
Yeah, very close.
Well, it was a lot colder in Cape Town though, isn't it?
No, it's beautiful.
Isn't it?
You have to go. It's gorgeous.
Okay.
Yeah. And then moved over when I was 2, and then I grew up in Sydney's western suburbs. So I'm a proud Panther girl. I love them.
Atta girl.
Bit of a bad year for the Panthers. They got knocked off for the first time in 5 years this year.
I know.
We'll talk about that.
I had a little tear. Don't worry. It's fine.
I was looking forward to seeing the extended, unbeatable consecutive grand finals. But
Look, they've won a few. It's okay. We can hand it over.
It's already unbeatable now for the whole consecutive factor, but yeah.
Yeah. Yeah,
Good
it's
stuff.
good footy. It was good footy.
Oh, top stuff. Yeah.
Yeah, so and then I lived out west. I travelled over to the UK where I met my beautiful husband, and he was a Wollongong boy, so go figure.
Oh, interesting.
Yeah,
Okay.
so that's how I ended up in the Gong.
Okay.
So you go all the way to England just to find a
No, right?
Well, travel from South Africa first.
Yeah, fair enough.
Isn't that interesting?
Yeah.
Just having a bit of a joke, you know. Yeah.
Were you hanging out with other Aussies in London, or how does that sort of happen?
Yeah, you just naturally gravitate in the shared houses and things that
Yeah.
you're either with Kiwis or Aussies. So,
okay.
yeah,
Interesting.
got some lifelong friends now out of that.
All right, cool. And what do you do when you're not working? You got any hobbies or crafts or?
I've got 2 kids that keep me very, very
Ooh, how
active.
old?
They're 5 and 8.
Oh, yes.
So they
okay.
just started school. The littlest one is in kindy. So yeah, look, they keep me very busy. But otherwise, I'm a total beach goer.
What's your favourite beach?
I like Port.
Yes.
I like
Good for
Port.
kids,
That's
isn't it?
my favourite. Yeah.
Great beach, top
yeah.
Nice and the offshore winds in summer. It's, that headland protects it, and we shouldn't
it's
talk too much about it because then
gorgeous.
people know about it. But
That's true. That's true.
it is a very beautiful
Yeah.
beach.
And
you know,
then
you
just-
probably don't know, but they used to take sand from there to put on the beaches of Hawaii because the sand
Are
was
you
so white.
kidding? No, I did
Yeah,
not
that's
know
why
that.
there's a lot of. If you see photos of Port, you know, in the 70s and 80s, there's a lot more sand there because they sand mined it to take it to Hawaii because it's so
That's
beautiful.
right, they did too.
Yeah, we want it back, Hawaii. Bring it back.
That's
Yeah,
great.
it's a nice beach.
Yeah, and then just chilling with the kids. We enjoy smoking meats and making cocktails and,
Alright.
yeah, going for bushwalks and things like that.
Oh,
But,
you want to
yeah.
go bushwalking?
Oh, in Mount Kembla, we enjoy it.
Okay, yeah. Cool,
Yeah.
Another advantage of having the mountains close to the sea.
Yeah.
It's
Yeah.
easier to get out to the bush.
Yeah,
you can see it from most
exactly.
places. Cool. And then, so to become an OT, what did you do? We
so-
you kind of had a little bit of a sidestep before you became an OT.
I did. So I did a degree in what's called leisure and health, which is a diversional therapy. And that really focuses on using leisure to help people either rehabilitate or just increase their quality of life. And so I worked in disabilities at that time with young adults. Back in the day, used to be challenging behaviours before they changed the term. At House with No Steps in Sunnyfield. So I guess I'm showing my age.
Out west?
Yeah, out west
Okay.
and the Ella in Haberfield. So, and we ran,
interesting.
I ran a day program out there for young adults with complex needs. So
Okay.
we used to work with clients or participants that were needing hoist changes and wheelchair and peg fed and behaviours of concern. So yeah, it was definitely an eye opener as a teen, and I loved it very much. And I loved working with disabilities. But then
Just jumping in, really interesting. I used to work with an organisation, Edmund. We used to supply a lot of casuals to those organisations.
oh really?
And my area was the Western Sydney, so I don't know if I did so much day programs. It was more the group homes.
Yeah.
But yeah, interesting.
Yeah. I worked in the group homes as well.
Yeah, okay.
And so I used to see the OTs come in and bring in the big equipment and see how they would do the education for us for manual handling and then the modifications, and it just really intrigued me.
So diversional therapy, was it more about programming? It wasn't about
It's
like
about
physical
programming.
therapy like you do as an OT or physio or something? It
Correct.
Was, okay.
Yeah. So
Interesting.
you'll find a lot of them doing either in palliative care or in day programs with programming of like how to increase their engagement in different leisure activities.
Okay.
Yeah.
And what are some of the tools of the trade there? Is there, I guess, motivational techniques or organisational things? Or
Again,
all
it's
above?
just client directed, similar concept as what occupational therapists do. So we find out really what it is they love to do. Like we had a client that was blind at the time, but he loved cooking. So we used to bake together and then he would sell it to the local cafes.
Okay.
And so then he had his own little business that he would run.
What did he bake? What kind of stuff?
Like muffins, cookies, that
Okay.
kind of thing for the local cafes. So that's something that a diversional therapist will look at. But it kind of, I feel like OT was a natural progression anyway from that.
Okay.
And
And there
so
was a degree to be a diversional therapist.
there was.
And then to become an OT, what did you need other qualifications?
Yeah, I went back and did a master's in occupational therapy.
Okay.
Yeah. So after I got back from London, I decided to, progress and continue growing and looking
All
at
along
different
the same
areas.
path?
Yeah, it felt like a natural progression.
Yeah.
Interesting. And I guess I've had a few OTs on the program, but it's always interesting asking, what does an OT do in general? No, I mean, we'll talk about what you do a little bit later, but,
Yeah.
you know.
You want the general spiel?
In 20 words or less, what's an OT?
I think that was the hardest thing to get your head around after university because occupational therapists do so much. and they can go into different fields. So it will look a little bit different in different fields. But ultimately what we do is we look at somebody's function and how they perform their daily activities. That's everything from getting out of bed to having a shower to getting out in the community to working.
To walking effectively?
Well, that's probably more physio. But we would look more at the positioning and seating for a wheelchair and script that kind of area. So, but we really...
So more on the equipment side of that sort of area.
Of the physical side?
Like learning to walk or something.
Yeah. We hand that over to the physios that side.
Physiotherapy.
Physiotherapy, yeah.
Yeah. I got a thing to say about it, but I don't think it's quite...
Oh, talk now, off and never hold your peace.
I don't mean bad or anything now, but physiotherapy... As much as I hated it at the time, is the reason I can walk, talk, move my arms and everything like that. Because when it happened to me, when Jessica first hit me in the head, hit me on the right side of my brain, so my whole left side of my body was dead. Couldn't even move my arms or anything like that. But after extensive physiotherapy and all that kind of thing, endured a whole, I'd say maybe years worth of pain, different stretches, different braces and that sort of thing on my arm. I can now move my hands, fingers again, play the guitar and everything.
Yeah.
Thankful for that. So thank you, physiotherapy. Yeah.
And I think that's the step of where OTs then come in. We look at the activities that it is that you want and you need to do. Mm-hmm. So then we will look at how your body moves in doing that activity, and we either alter the activity, we alter the environment, so we might do some modifications to help you be able to do all those things.
I was still in a wheelchair too, so I needed to. I was trying to get out of the wheelchair because I hated the fact that I was stuck in a wheelchair. But
so physios and OTs work together, and I guess physios are the physical capacity of the person, and the OTs are that kind of environmental capacity.
The function of the actual task of what it is that you need to do and what you want to do.
And it sounds like a lot of pain for a lot of gain there, Tony.
Of course.
Yeah, no pain, no gain, as they say.
I'm thankful that I was able to have the right directioning and everything from my family and whatnot to make sure I stuck with the right, stayed on the right path. Yeah, almost lost it there, but okay.
Cool. All right. That's. I think Tony's about to say we'll play some music. And we'll come back and.
You said you liked Fleetwood Mac, didn't you?
I do like Fleetwood Mac.
But I'm going to play some Fleetwood Mac straight after this one. I've got some Mungo Jerry in the Summertime from the 1970 album of the same name, In the Summertime, which makes it, I think it was eponymous or something like that. Yeah, big fancy word, but anyway. So Mungo Jerry, then Fleetwood Mac. Yeah. Yes, of course, that was just Fleetwood Mac with Say You Love Me from 1975. Fleetwood Mac, self-titled album. This was basically also known as their White Album. That's another Beatles reference for Fleetwood Mac, so there we go. Fleetwood Mac have a White Album. There we go.
We're just talking there, the very Eagles sound, didn't it, that one?
Yes, and because the song was actually written by...
Christine
McVie.
Christine McVie.
So it was a Fleetwood Mac person, but
Fleetwood Mac wrote the song from Fleetwood Mac, so there we go, But she wrote in a very Eagles-esque style, yes. I don't know how we'll bring in the Magic C with their copyright, but All right, no worries. Let's go back to the interview.
All right, so we talked in general about an OT, but what do you do? What's your OT kind of day look like?
Yeah, at Seachange we have everything from pediatrics to NDIS, aged care, packages as well, and we do some insurance as well.
Okay.
I don't touch peds. I don't want to work with kids. My kids are enough, and I love them.
Don't work with kids and animals, they say.
Yeah, exactly. But I do everything from young adults until palliative care.
Okay.
Yeah.
So wide age gap.
Huge age gap, with all the different diagnoses.
I should just jump in and say we're talking from Lesley from Seachange Health Professionals.
I forgot to say that. I'm sorry. Sorry, I
in case people have just tuned in.
Yes.
Yeah.
Totally smooth and professional we are. We're totally smooth and professional.
100%. That's why it's all...
It's a well-oiled machine, you guys. It's awesome. It's awesome.
And so what does that involve? What kind of stuff do you do?
Yeah, so...
Or is it be quicker to say what you don't do?
No, that's fine. So I'm a clinical lead at Seachange, so I do a lot of complex clients. So
needs, yes.
Sorry?
Higher needs.
High-end needs, yeah. So MS, MND, big equipment prescription.
MS, multiple sclerosis, MND.
Yep. Motor neurons disease,
Is
yep.
that known as Huntington's.
It's another. That's
What's the
different
one?
again.
Oh, it's different.
Yeah,
one.
it's different
What's
again.
it called? It's because it's American.
Huntington's disease.
Huntington's.
That's the American name for something similar, isn't it?
Oh, I don't know.
I think it's different name as a different disease in Australia.
research.
But anyway,
Oh, yeah.
sorry.
That's
Very
okay.
complex question.
So I do the major modifications. So I saw you had Shannon on the podcast as well, on the radio with you guys. So we do big bathroom modifications, ramped access for wheelchair, or walked, or any kind of wheeled access when stairs become a bit of an issue. Everything from door automation for clients as well. So
Okay, cool.
we do everything for the home modifications to make your home safe, to maintain your independence at home. And then all the big equipment prescriptions, so power wheelchairs to hospital beds to, pressure care. It's quite a
What's
big
pressure
range.
care?
Pressure care is what used to be called, I guess, bed sores, but
Okay.
now they call it pressure injuries.
Yep.
Wow.
So pressure injuries can happen within 20 minutes. So we are very active in doing our preventative care.
What
when
are
it
some of the
comes
things you
to
do
that.
to prevent pressure sores?
Well,
Bits of equipment you use.
yeah, so we have a look. There's a range depending on the severity, but yeah, so we can put in cushions to help offload the pressure. We can also do mattresses as well to kind of alleviate that pressure and spread it out, so it's not just on your bony prominences like the hard, your bottom, your back, your heels. But really, it's about education, getting people up and moving as frequently as they can.
Is it a what would you call a circulation thing, or
Circulatory.
can't move muscles, so you're sitting?
It's more a sedentary thing, and also sliding, which creates shear and friction. So
people getting out of bed and things.
yeah. So they're sliding down the bed, or if they're not really positioned correctly in your wheelchair, it can put all that pressure down through the bottom.
Yep.
So we
Pressure
try and
on
prevent
the
that.
wrong parts of the body, yes?
That's correct. Yeah. So we do a lot of that as well.
Okay.
I
I know. I worked with a gentleman a while ago that had a bed that had different cells in the mattress that inflated and deflated to sort of keep moving the pressure around. And
So it customized to his body's position, yes?
well,
It more moves so that you got pressure over different parts of the body.
it did do a bit of that because it did deflate a little bit so that
Yes.
it did fit his contours. But
Yeah.
different parts of the bed would inflate and deflate. So there was pressure here, then pressure there, and
I remember
Yeah.
the exact thing you're talking about, Sean, 'cause in the is it transitional home that's between hospital and home?
Yeah,
Oh, yeah.
short term, yeah.
Had the same sort of setup as what you just described then. He was laid in a bed, but he was unable to really move or anything like that.
Mm-hmm.
So the bed inflated and deflated. So it was more for circulation. So his blood kept flowing, so he wouldn't get any blood clots or anything like that. Is that the same sort of thing?
and I think probably jumping in, Leslie probably knows more about this than me, but
Sorry.
like at night you wake up and you feel a bit stiff and sore, you move around. Well, these are for people that can't move around when they feel stiff and sore. So yeah, that kind of
Or maybe that was the exact reason I just took it off the wrong turn in by saying blood clots. Okay.
yeah, interesting, cool.
Yeah.
So lots of great equipment.
Yeah, huge equipments and small stuff too,
Yeah.
like little things. We might do some built up cutlery, but I mean, the goal isn't just to give the cutlery, it's so that person can go out, have a meal with their family and live with dignity.
Yeah.
So
Have you got any kind of, obviously don't want to know names and things like that, but any kind of interesting stories or unusual things that you've done? Put you on the spot.
I'm going to try and think of
Within reason,
confidentiality
you're on the radio.
here.
Yeah.
So, we just literally came from a client just before I came here, and the bed, we had to set up a bed. We prescribed a hoist so that we could get him in and out of the bed. But the actual alternation of the bed, we took out a cell so his heels were offloaded, which was amazing. So
What's offloaded mean?
So it means that it's completely elevated and it's not touching the bed at all,
Okay.
because he had some
Pressure issues
injuries on his
yeah.
heels.
Okay.
Yeah. So you can still play around and we can modify different equipment. We don't do a one size kind of fits all.
Yep.
We make sure that it's what that client needs in their space.
And so, like, if it's possible to explain, but how do you work that out? So you've got the bit of equipment. Do you have like a set of rulers or protractors, or how do you kind of
Protractor.
What needs to be
how do you work out that
evident
individual?
to say that that's
Yeah.
this that he's affected by this problem here, and this is what we do for this problem here.
Yeah, see, I think this is why OTs are amazing in what they do, because we really assess a client holistically. So we look at the person, and that could be all the intrinsic factors, so cognition, sensory processing, psychosocial as well, like their mood, their sleep, etc. And obviously the physics of it. So we always do functional assessments as well. So we do look at how you move. And then we take into account the extrinsic factors. So we look at the home environment, we look at their support network that they have as well, because all that is really important as to what it is that we can put in to see whether or not it's sustainable.
And obviously funding levels, I think.
And funding levels, absolutely. Your stakeholders as well, that obviously comes into play. And then we look at the tasks that we're actually needing to do. So in his case, it was really to increase his sleep quality. It was about helping the carer to maintain her role as carer.
Family
and
carer,
doing,
it sounds like?
Yeah,
Okay,
family carer. So making sure she's safe and looking at her manual handling.
Yep.
And then we figure all that out. And through our research and our education and clinical justification, and that's how we go with our prescription, and we do our trials to make sure it fits.
And obviously some of the things that get pretty expensive, I imagine, are bathroom remodelling and, a house has got a number of stairs, an entrance exit or something, putting ramps in.
Yeah.
Well,
the last bathroom modification.
Sorry, I have to jump in right there. Some people have even gone to the extent of getting elevators put in so they don't have to use stairs at all.
Yeah, we do that as well.
Cheap.
Yes.
No, that's not cheap. The last major bathroom modification quote that came in, but it did have structural wall changes, so we can actually change the size of the bathroom if possible, just to increase that circulation space for someone with a disability or is aging that needs wheelchair access. And that came in, I think, about 60.
Okay.
So yeah, it's not.
Is that, you mean $1,000?
$1,000.
$60,000.
I was used to like 60 grand. I'm like, okay.
I know it's one of those things with bathrooms. You can't just make a little change in one thing. Once you break that membrane, you got to rip it all off.
You rip it all out.
Yeah, it's a lot of work.
But at least they get to stay in their own home and they're safe.
A familiar environment. That's right, yes.
Absolutely.
And I guess if you counter that against the cost of, say, a hospital or a specialised facility, $60,000 is probably
nothing.
3 or 4 months worth of time there. So if they can stay at home and
absolutely.
And it's sort of, not only does the person have a better life, which is fantastic, but obviously the cost is where the government probably focuses mostly on it. Overall cost is reduced. Value, that's the word. Yeah.
Absolutely.
So it's interesting. Sometimes people get caught up and go, well, look at these thousands of dollars for this or for that.
Yeah.
But I guess when you look at the long-term thing, it's actually saving a lot of money.
Oh, absolutely.
Because a lot of the people, they might just be very, excuse the terminology here, but they just might be very short-sighted in that respect because they can't see beyond to the bigger picture. I'm using very, very imaginative terms there, but yeah.
And it's probably a good opportunity for me to trundle out one of my hobby horses. Should have been called the National Disability Investment Scheme, not the insurance scheme, because it's investing in people's capacities.
Oh, I love that.
Yeah. So, and also insurance is not very sexy. If if I gave my kids an insurance as a present for Christmas, they probably wouldn't like me very much, But if you gave them an investment as a property and as a present, they probably would. So, I think it sounds better and it more captures what the NDIS does.
It's certainly got a lot more scope, and maybe.
It's a lot more positive sounding.
It is a lot more
insurance is about
sounding.
problems and issues and fixing up bad things.
And post.
After the problem.
After the fact.
Because insurance to me is a big just in case, although this is more, must be prepared for something bad to happen.
Yes.
So,
Whereas investment is going, okay, how can we make things that are
better, good
or whatever better? It's a positive focus.
Yeah, I love that.
Yeah, interesting.
Off to Canberra you go.
I was actually involved with a lot in a kind of interesting capacity when the NDIS was put together, and I did say that a lot, but no, it didn't.
Didn't take
I
it.
remember
Didn't take
you
it.
said that, yes.
One of the guys that was putting together was a relative of a CEO of an organisation I work for. We had some very interesting barbecues as it was getting put together, and I was like, investment. He's like, out of my pay rate. I was like, come on, but anyway.
Well, that's all very good news. A strong points there, Sean.
Yep.
Now I'm going to get straight back to this. After this, straight back to that, and some birds and Paul Kelly. After these quick messages, here we go. Okay, yes, that was just very Australian right there. Paul Kelly and the Coloured Girls from a song called Leaps and Bounds from his second album, 1987's Under the Sun. Sorry, it was released in 1987. Album Under the Sun, second album by Paul Kelly and the Coloured Girls. I don't think that name would last very long these days, but it's okay. Back in the 80s, anything flew, I guess. But before that, you heard me play The Byrds, that's Byrds, with their song Mr. Tambourine Man from 1965, written by Bob Dylan in the same year. Now, I know it actually appears on it's a Forrest Gump feature from 1994, the film, a great film, yeah.
I'm just feeling old. Forrest Gump was made 30 years ago.
Yeah. Hey,
Wow.
I officially feel old.
it's still... Yeah,
It's a classic.
It's still good,
I grew
but
up with it, yes, it's great.
it's a bit sad when you can say, oh, I saw something 30 years ago when
In
I
the
wasn't
movies?
a kid. Yeah. I drove my car to see it.
I didn't get that opportunity.
How well, you I'd love to have seen that when you were...
No, but you didn't get to drive my car there.
Oh, no, but
Jeez.
yeah. But don't pretend you're young.
No, I ain't young, that's not the point.
You're an old bugger like I am.
Yeah, thereabouts. So, but yeah, all in all, it stood the test of time, and so is all the songs I just played here now. So there we go. Time
Cool.
is the greatest judger, I suppose. Yes. Anyway, let's get back to the interview with Lesley and yourself, Sean.
Yeah, so we're talking with Lesley from
Seachange.
Seachange Health Professionals, and we've talked a little bit about Lesley and what she does. What does Seachange Health Professionals do as an organisation?
Yeah, so we are a bunch of amazing multidisciplinary clinicians. So we have occupational therapists, physiotherapists, dietitians as well, podiatry. We also offer behaviour support practitioners.
All the medical stuff, yeah?
Yeah, all
Clinical.
the allied health stuff, yeah. And support coordination for NDIS as well.
Of course.
Okay.
So yeah, we, like I mentioned before, we do everything from paediatrics to aged care, and we have some physios in residential aged care facilities as well.
And insurance stuff, I think. you
And a
mentioned
little bit
before.
of insurance as well,
And,
yeah.
and where are they based? What areas do they cover?
Yeah, so we cover the Illawarra and Shoalhaven. We also have a branch up in Port Macquarie and Maxville, and we have a lone OT over at Goulburn that started a couple of months
interesting.
back. Yeah.
There's some outreaches there. You've skipped over Sydney and gone way north.
yeah. We thought we'd do all the seaside towns,
Okay.
but then one person threw it off and went to Goulburn. But there's a
Okay.
big need for OTs out there. So
Goulburn's huge. I think with the Sydney prices, the amount of people with disabilities and aged care moving out to Goulburn is just has been for the last 15 or 20 years. Is
and it's
massive.
a gorgeous town.
It is.
It's really
Interesting
gorgeous.
history, but very gorgeous town.
Yeah.
It's a bit of a rough town back in the day.
Yeah.
Very nice though.
But weren't all back in the day?
And I think Goulburn was a little bit extra rough.
Oh, next level rough. Okay.
Yeah. It's, And also, of course, they've got the big sheep, the big merino.
Of course. The
Oh,
Merino sheep.
yes. You always should stop off at the Maccas on the way to the snow.
Yes.
Always
Yeah.
Maccas. It's everywhere, isn't it?
And so what are the advantage? Actually, I'll get distracted, but I was in Western Sydney near Campbelltown and Camden, and I realised I drove past 4 Maccas within about 2 kilometres.
Oh,
If you
wow.
turn left, I forget the road to head towards Camden off the motorway.
But
Yeah.
There's Maccas.
Narellan.
Narellan. That's
So
Yeah.
there's so many of them now. You can't use them as key places anymore. Say, oh yeah, it's just next to Macca's.
Yeah.
It's like,
Which one?
Which one?
Macca's, yeah. Oh,
Especially
they're-
Narellan. Even if you said
Yeah.
Maccas and Narellan, there's 3 of them. So.
Wow.
Oh, goodness.
Yeah. Anyway, I'm putting
Yeah.
a free ad.
That's just-
So what's the advantage of having a multidisciplinary team?
Just to give that really holistic care to our participants and to our aged care clients, because whenever we have an issue, we can kind of problem solve it together. And it always works better when you have a whole team around you to support you
Different
in those
perspectives,
things.
yes.
Yeah, different perspectives. So there's obviously some overlay between the different professionals anyway. So it's nice to kind of feed off each other and work together.
that way they can meet each other on the borderline between each other, like the overlap, and
Yeah.
find what's best for the individual.
Yeah.
Which is-
And, 2 heads are better than one, and it's good to have the different perspectives coming
That's
in
right.
from our clinical
And I
set.
found sometimes, and it's in some ways a good thing, that you got a physio and OT and there is that overlap of what they do,
Yep.
but they've got different ideas or different experiences. They come at things a different way.
Absolutely.
And sometimes there can be a bit of a cross purpose of, you get one thing from the physio, one thing from the OT that they're different. They're not like clashing against each other, but they're different. It's like, well, but having that multidisciplinary team where you can talk to each other and know each other and bounce off each other, I think makes that line, that threshold a little bit, that interface work a lot more.
Absolutely. Even
yeah.
with using BSPs now, like
Yes.
behaviour support practitioners, and talking about, the OTs might talk about sensory processing and all the issues that might be creating some of those behaviours of concern, and then working together to come up with different strategies as well on how we can try and help with their communication and minimise that agitation.
Cool. How many people work there?
Oh, goodness. I oversee the OT, so I think we are up to 12 occupational therapists now.
Huge.
Yeah. So we've got quite a few. I don't know how big our team is because we're across different sites.
Yeah.
But, yeah, we're well and truly over 30 to 40 now.
Wow. Where's head office?
We're all mobile. So, yeah, we're completely hybrid. So we all do community-based.
Isn't it?
Yeah.
Having no central office.
It's good, and that's what I love about the company. They're all about life, work-life balance and having that flexibility, which is great with the kids. So,
and it's great to be able to meet people where they live because that's where their life happens. So,
and a time that works for them.
Yeah.
You know, we want to see them when they're, at their worst, so you can see what their function's like at their worst, but also at their best.
How deep they can go, yeah.
Yeah, and then we know how much intervention and support they require.
And I was also just thinking to myself then, I think when you just said, you mentioned what you were talking about, how OTs and physios and sort of thing. So OTs is more a why, and a physio is more of a what, as in like what you have to do to fix the problem. But you'd be more of a why that problem is occurring, yes, or something like that. Is that too much, too deep?
No, I think physios explore that as well.
Fair enough.
I think they're more just the biomechanical side, obviously, of the movement and the respiratory, whereas we're about daily activities and making sure that you have what you need to do meaningful based activities.
So in simpler terms, so which one of you be more practical and the other one more
I think that's hard to from my no. What I think is physios are more about the physical capability of the person.
Yep.
So muscles and strength and capacity and that sort of thing, and then OTs are more around that person. So equipment, access.
Helpful tools, that sort of thing, yes?
So I'll give you an example. We have a client that had a stroke and he has very strong hip flexion, so he can't quite get over the bathtub, right? Because he can't bend it enough. So the physio is working with them to increase that range, whereas then I'm working with him because it's talking about an activity which is showering. How are we actually going to get him to shower? So looking at the equipment that would be suitable. If not, then I will be talking about modifications.
Physio is more like a personal help, and then you're more of a...
So the muscles and strength.
The balance, coordination. They also do all the respiratory stuff as well.
Beautiful. I'm sorry.
But there is there's a big grey area. It's like a Venn diagram with a lot of crossover in the middle.
Yeah.
Correct. There's quite a few laps.
Yeah, so that's why I always like to ask, because there is that crossover. It's very hard to define.
Yeah.
So you mentioned a little bit earlier you've got a seminar coming up.
I do, yeah. It's OT week coming up at the end of October. And so we are running a free seminar on the 30th of October at 11:30 at the Dapto Ribbonwood. Is it Ribbonwood Centre, yes. So it's just going to be an hour, and it's going to be just discussing all the different ways that OTs can support you within your home. I'm going to, one of the OTs will run a bit of a section on falls prevention and different ways that we can try and prevent falls happening within the home.
And you probably do know this, but slips, trips and falls are like well over half of the cause of a lot of incidents in people's homes.
Yeah.
Where people get hurt and permanent damage. You don't sort of hear about it. You hear about electrocution or whatever, but slip, trips and falls, if we can eliminate those.
It's one of the biggest hospital admission reasons. So
I think you said you brought it up earlier, Sean, because the NDIS, the attractiveness, the insurance scheme, that sort of thing, or slips, trips and falls aren't as attractive as other things.
Yeah, so if you can prevent it, if you get in there and stop that from happening, that there is an investment, because if people don't fall over and in terms of aged care, break a hip, and all the massive drastic effects that can have, especially as you get older, that can be prevented, then save money and quality of life.
Unfortunately, that did happen to my grandma. She was 90. Yep. She was only on one medication for high blood pressure. She came to visit me in London, so she was super active. One fall and it completely changed her life. So I'm very passionate about falls prevention. It doesn't matter what age you are, really, whether it's environmental or just to get you aware of what could potentially make you fall and how to reduce that risk.
So handrails on stairs can make a big difference.
Massive difference.
Not even has to be expensive things, but just little, design things. Yeah.
Or even just, as our eyes deteriorate as we get older as well, just little things like fluorescent lighting and just showing about depth perception and things like that. Night lights can make a huge difference. And we'll also run a little hands-on therapy session for arthritic hands on how to...
Hands-on for hands?
Yeah, hands for hands. On how to preserve your joints. And we also have an amazing supplier out at Country Care bringing some aids to show how little pieces of equipment can really make those tasks a little bit easier for you and maintain your independence. And then I'm going to run a fun bingo session.
Bingo. Everyone's bingo.
Yeah.
Very simple.
One before we, I know you want to do it. Let's just ask one more quick question. If you had a magic wand, and it's like got OT magic in it, what would you use it? What would you wave the wand at, and what would happen?
So many. So many.
What's the biggest?
It's too big a question, isn't it?
I think reduction of waiting times.
Yes.
So people can access the things that they need now. So whether that be aged care and having an ACAT assessment and, getting the services in place, or whether it be NDIS and the participant, they do the wheelchair trials and they don't have to wait 18 months for it. Or even if you're waiting for surgery at the moment, there's such a huge waiting list and it's debilitating for a lot of people.
And obviously a lot of deterioration as well. If you can't walk, then when you get the operation or the equipment or whatever it is and you start walking in those muscles.
Yeah, exactly. And you might need something more and more. So I wish we could kind of access the stuff that we needed sooner.
Yeah, okay.
So just to comment on that one there, reduction of waiting times, I would say reduction in the number of hoops you have to jump through just to get to see the specialists and what they have to do and find out what the root of the problem is and trying different medications, different...
And again,
like that. Yes.
it fits in with investment because a little bit of money spent to get that access happening means that people need less support and less interventions and less equipment. Yeah. So you're saving money at the end of the day.
Absolutely.
100%.
It's even GPs, getting into a GP when you're sick so you don't have to wait to go to emergency. So I feel like everything is compiling a little bit at the moment. So it'd be nice to be able to access the things that you need.
Well, yes.
Yeah.
Okay, cool. All right.
Okay, well, I'm just going to jump in there and play you couple songs.
Before you do, I just thank Lesley for coming in.
Of course,
And I think we'll play music out to the thing. It'll be very interesting.
It's been so lovely being here. Thank you for having me.
Wasn't it?
Yeah.
Not too bad.
Well, there you go. Now you can say you've been on the radio, yes?
Yeah.
True, I've never been on a radio before.
Well, I'm happy to be part of the first time for you then, yes? I don't mean,
Thanks, Tony. It was lovely. Thanks, Tony.
Yeah, don't worry. Okay. Here's Jojo Zepp and the Falcons with Shape I'm In from 1979 album, Screaming Targets. And after that, we'll see what happens next. Here we go. Yes. That was
Your station, VOX FM 106.9.
Yes, jumped a bit early there. Okay, that was just Jewel with You Were Meant For Me from the 1996 album, Pieces of You. And yes, this is now come to the end of the show for another week. Don't forget to stay listening for the Smooth Connection coming up right after this with Eileen on the other side. Good stuff. Okay, now I want to thank you again, Lesley.
Thanks, Tony.
And of course, Sean, thanks for showing.
Always good to be in. I wish I could be more often, but also it's good for Beck to be in here. And just if people are interested in Seachange Health Professionals, you can Google them and find out all about the wonderful things that they do.